Well, 1 in 5 Americans experiences an unexpected bill after receiving medical treatment, and as the president has prioritized lowering healthcare costs, many are asking what's being done to relieve this financial headache. One America's Jenn Pellegrino has more on that from Washington.
Well, Rick, thank you so much for joining me, President of Americans for Limited Government.
Yep.
Tell us, for those that don't know, what is surprise medical billing?
Surprise medical billing is when you go to the doctor, you go to the hospital, and you think your insurance is going to cover it, and lo and behold, they don't, and you're basically caught in the middle as a patient between a fight between your healthcare provider and the insurance company. It turns out that about 1 in 5 Americans has experienced this phenomenon, and it's a big fight right now because essentially Obamacare destroyed the market system in terms of healthcare, and in doing so, they've created an incentive for insurers to be pretty tough in terms of reimbursements. And the people who provide the healthcare, you don't get healthcare from insurers. You get healthcare from doctors and anesthesiologists and others, and nurses. And those people are now being stuck with a situation where it costs them X amount, but they're only being reimbursed a smaller amount than that, and they have to figure out how they're going to get paid and how they're going to be able to stay in business.
So President Trump, one of his priorities has been, transparency in healthcare, lowering the costs. What's being done right now to curb this? Well,
first of all, he did put something in place, which is a regulation which requires transparency for healthcare providers, for hospitals and the like, in terms of all the prices. So you can look at price lists in advance and determine, and essentially you can negotiate in advance. If you're in an emergency situation, you're not negotiating from the emergency room, but if you've got a scheduled visit for something, you can go and cost compare, colonoscopy, things like that. So that's a really good step in terms of creating patient ability to control costs. There's 2 solutions being offered. Solution A is Lamar Alexander from Tennessee has Solution A, and it's a bad idea. It's one-size-fits-all pricing. You pay the same amount in Nashville, Tennessee as you do in Austin, Texas, as you do in LA, California. That system is proven to fail. It's proven to drive providers out of business in California where it's been tested. The other solution, Denver Riggleman from the state of Virginia has it, and create an arbitration system where you, the patient, don't get stuck in the middle. Let the doctors and the anesthesiologists and the providers fight it out with the insurers in front of an arbiter and come to a fair conclusion that doesn't make you have to pay the price because they can't figure out. The bottom line on this is very simple. That's a problem between the insurer and the provider, and we need to set up a system where those two get together and work out what is fair in terms of compensation between themselves, and you shouldn't be stuck in the middle, although it is a good thing for you to know what the price of health care is so you can make informed choices, which is why the president's policy of transparency is really a great step.
Rick, thank you so much.
Not a problem. Thank you.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.